Hello, good evening, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. This is a COVID world news. In this presentation, we are going to be looking at COVID pandemic with special reference to Middle East, Turkey versus Iran. So let us begin. First, we're going to look at the overall coronavirus pandemic in the globe. There are 7.28 million people who have active coronavirus infection in the world, with more than 412,000 deaths. The interesting point is almost half of them have recovered from the coronavirus infection. And here is a chart showing the number of new cases all across the globe, which was around 100,000. Now, in the last several days, it has gone up to 125,000 new cases per day. And just in the last couple of days, it has shown some decline. But this is something we need to be watching carefully as the days and weeks come by to see if these numbers are continuing to go up or they begin to show signs of decline. In this chart, we see the daily death counts all across the world. It peaked around 15th. From that time onwards, it has steadily come down. At the peak, there were like more than 8,000 deaths per day from the coronavirus pandemic. It is definitely coming down, and we need to watch this for the next several weeks to see if these numbers continue to slow down or whether they begin to increase because of many countries coming out of the lockdown situations. This is a very busy chart, but I want to point out some important facts. United States, as you can see, tops the chart in terms of number of coronavirus cases. In the United States, we have more than 2 million people who have active coronavirus infections, and it's going up at a rate of 18,000 or 19,000 per day, and it has resulted in more than 115,000 deaths. United States also has done more than 21 million coronavirus tests, which is the highest compared to any other countries in the world. We are going to look at especially Iran, which had a total number of cases at 171,000 plus, along with Turkey, which had a similar number of cases. So we're going to explore the similarities and differences between Turkey and Iran. Here is a map showing the Middle East, including Turkey, which is located here just to the east of Europe. And next to that is Syria, Iraq, and this large country, Iran. They are adjacent to each other, and their responses to coronavirus pandemic are quite different, and we're going to take a look at those. Here is Turkey and here is Iran. In Turkey, they had 172,000 active coronavirus cases, resulting in 4,729 deaths and 144,000 plus having recovered. Let's contrast that with Iran, which also had a similar number of active coronavirus cases, but their death toll was like 8,500 plus, and 140,000 plus had recovered. So just looking at this chart, we can say that the deaths in Turkey were little less than 50% compared to the number of deaths in Iran. Here are the charts showing the coronavirus epidemic as it evolved in Turkey. As you can see, it started somewhere along 10th to 16th of March. It reached a peak around April 10 or 11, and from then onwards it has shown a steady decline, as you would expect to see in a typical epidemic or a pandemic. This was a similar situation in Wuhan, China, and let's contrast that with the graph here from Iran. Iran started its epidemic somewhere in the third week of February, and it reached a peak somewhere along March 29th to 30th. From then, it was showing a typical decline as you would expect to see in a bell curve or a forward curve of a virus epidemic. However, Iran lifted its lockdown on April 11th, somewhere along here, and 2 weeks later, it has seen a second wave or resurgence of new cases in Iran, and we will explore this further and see what we can learn from this and how other countries can take lessons from this as to how they deal with when they remove the lockdown. The death chart looks very familiar, bell-shaped curve here in Turkey, whereas in Iran, it had a similar bell-shaped curve with a flat top for several days. Then it came down, and it looks like it is continuing to stay around 50 to 60 cases, but it is showing an uptrend recently. Given the fact there has been a second coronavirus epidemic here in Iran, you would expect the death tolls to be climbing in the coming days and weeks. Now, here are the numbers. The most interesting thing is Turkey and Iran have almost similar population, whereas the Turkey's population is 84.3 million, while that of Iran is 83.8 million. So population-wise, they are very similar, but the death rates are almost quite different. And the number of people tested in Iran were much larger compared to the number of people who were tested in Turkey. The death rate in Turkey was 56 per million population, whereas in Iran, the death rate was close to 100 per million population. These two countries are very similar in population size, in terms of geographic location, in terms of number of people tested. Why do we see a big disparity in the death count in Turkey compared to Iran? So let's see if there are some explanations as to how they approach these problems and what were their challenges. Turkey. How did Turkey manage to cut their death toll by 45% compared to that of Iran? Interestingly, when someone called the doctor's office or the emergency room with a cough, fever, or cold symptoms, they were not told to take some medication and stay home. They were all invited to the hospital, and they were immediately started on chloroquine right away without even waiting for any tests. They also treated most of their patients with azithromycin along with chloroquine. They also used vipiravir, which is an antiviral agent, which was also used in China for patients who were intubated. They used high-pressure oxygen in patients with respiratory difficulties in the very early stages. That's an important thing that we should learn. Any intervention we do must be done at the early stages of the disease before there is any significant damage to the lung tissue, which can lead to complications if not treated earlier. Turkey also put their sick patients in prone position as they were done in Wuhan, China. Turkey cut off all international travel in February. As you know, Turkey is a major air travel hub for many international passengers and airlines, but nonetheless, Turkey took an affirmative action to cut down all international travel in February. Interestingly enough, Turkey never had a complete lockdown as we have seen in many parts of the world. They had a complex curfew system, and it apparently seems to have worked, which allowed for healthy people to work and essential businesses to function, while at the same time protecting the elderly and the vulnerable population. Turkey invested billions of dollars in their healthcare system They had a much higher ICU capacity. They hired the best people to serve their citizens without any cost. In May, there are not, which is there are chances of someone passing on the infection to a different person, was at 1.6. That means each person could infect 1.56 more people, but by June 9th, their R naught had decreased to 0.72, which is a very good number, under which the chances of getting widespread infection are low. Now let's look at Iran and see what were the differences when it came to dealing with coronavirus epidemic. Iran had just overcome the protests in November 2019. There was an influx of a number of cases of coronavirus which came from China through the travelers traveling back and forth from China and Iran. They did have a lockdown, but surprisingly, after they lifted their lockdown on April 11th, there was some quiet period for 2 weeks, and after that, there has been a resurgence of the number of active cases, creating a second wave of coronavirus infection, which may account for the increased number of deaths in Iran. As you know, Iran has also been struggling with long-term sanctions, economic crisis, free falling oil prices, and people unrest. Iran also had their 41st anniversary of revolution and parliamentary elections. Just like many other countries, they were also short on PPEs for the patients and for the healthcare providers. Due to the resurgence of active cases in the middle and end of May, they had to reinstate containment in the southwest part of Iran. This is an overview of two Middle Eastern countries, Turkey and Iran. What can we learn from their experiences, and how can we use that information to deal with when our cities and states are trying to come out of a lockdown position and trying to reopen their economies? First of all, I think we need to watch out for a second wave. When we open up our businesses and economy, there is going to be an increase in the number of new cases as more and more tests are done. There are going to be more chances for people to get infected at the workplaces. So we had to take a very aggressive step to identify active cases. Once we identify these active cases, we absolutely have to quarantine these active cases. In addition to taking care of the active cases, we may have to hire thousands of people to conduct the contact tracing, at least for the next 4 to 6 weeks, so that we can meticulously identify those people who are at the highest risk of spreading the infection, and then separate them from the normal people who can return to work and jumpstart the economy. The second lesson we want to keep in mind is the authorities need to be very transparent about their data. Time and again, when things are not going right, fingers have been pointed all across the globe about the accuracy of the data, about the openness of providing adequate information to the public. So, ladies and gentlemen, this is a real wake-up call for all of us as healthcare providers, state and county leaders who are pushing to open the economies despite persistent coronavirus pandemic, which is in full swing as we speak. Thank you so much for watching this COVID-19 pandemic world news. I am Dr. Nik Nikam, and please do subscribe to our YouTube channel. We will see you next time.